What is grinding or clenching? Grinding or clenching of teeth is a parafunctional and involuntary activity. Bruxism is a medical term that is used to define this condition. Although bruxism is more common while sleeping, the affected people can continue doing this even while awake. This condition is not a threat if its occurrence is occasional. But it could have extreme consequences if it occurs regularly. What causes teeth grinding? Teeth grinding can occur as a result of multiple factors. The most common causes include anxiety. Individuals facing stress and anxiety have a higher probability of developing this condition. Medications. In certain cases, teeth grinding is a side effect of prescription medicines like antidepressants. Sleep disorders. If you snore while sleeping or face difficulty falling asleep, you are more prone to grind your teeth while asleep. Sleep paralysis. This is a phenomenon that leads to temporary immobility while falling asleep or waking up. Sleep paralysis can also lead to teeth grinding. Smoking and drinking. Tobacco use and drinking alcohol are some other factors that prompt teeth grinding. Caffeine. Caffeinated drinks like tea and coffee can also increase chances of bruxism. Subscribe us to know more health tips and home remedies.